Hi everyone, today's video is going to be on heart rate variability. Heart rate variability is the natural variation in time between your heartbeats. So if your heart rate is 60 beats per minute, your heart does not beat exactly once every second. If you're looking at a EKG, the time between our interval on it fluctuates slightly beat from beat or beat to beat. So that's what heart rate variability measures, is those fluctuations. Heart rate variability is a marker of the autonomic nervous system balance, specifically the interaction between the sympathetic nervous system and the parasympathetic nervous system. A higher heart rate variability, such as that greater beat to beat variation, is indicative of a strong parasympathetic vagal influence, which suggests that you have a flexible and adaptable autonomic control. This is important because it's associated with things like good cardiovascular fitness, better stress resilience, more efficient recovery, and then also kind of going hand in hand with good cardiovascular fitness, that lowering that cardiovascular disease risk. So lower heart rate variability means there's less variation between beats, and it reflects the sympathetic dominance or reduced vagal tones. And this is associated with the psychological stress, overtraining, any illnesses, sleep deprivation, and then obviously increased cardiovascular risk. So basically, what we're getting from that is if you have a higher heart rate variability, then you have a healthy autonomic nervous system flexibility. And if you have a lower heart rate variability, then you have a reduced autonomic nervous system adaptability. So for the article, I chose an article, since I'm on the CEP track, that deals with diseased population. So heart rate variability, this is what the article's called: Heart Rate Variability, Reference Values and Role for Clinical Profile and Mortality in Individuals with Heart Failure. So the purpose of this study was to establish reference values for various heart rate variability measurements in adults. This article specifically looked at participants with chronic heart failure. So this study wanted to identify clinical factors like age, risk factors, comorbidities, and then how those are associated in differences in heart rate variability. This article also wanted to evaluate how heart rate variability relates to mortality outcomes over time in specifically these heart failure participants. So this study was a prospective observational cohort study, and they used data from the MAIO-VASC study, which was a large prospective study on individuals with heart failure. The participants in the MAIO-VASC study were classified into the stages of heart failure using a echocardiograph to assess kind of that status, that cardiac status. They also did ECG recordings, and they were analyzed in 1,001 participants. So the team selected heart rate variability metrics using systematic literature review and then machine learning models to identify the most prognostically informative heart rate variability features. So clinical variables like age, dyslipidemia, comorbidities, all of those were analyzed in relation to heart rate variability using multivariable regression, which means that they have two or more dependent outcome variables. They also tested survival analysis to determine heart rate variability markers to predict mortality risk over 6.5 years. So the results of this study suggest that heart rate variability is related to a clinical profile, that it measures varied systematically with factors that they looked at, like age, sex, dyslipidemia, family history, peripheral artery disease, and then heart failure. And then also some of those comorbidities such as diabetes or obesity showed stronger association with nonlinear heart rate variability parameters than traditional time or frequency domain measures. The study also suggested that heart rate variability was a predictor for mortality. Powerful prognostic heart rate variability markers for all-cause mortality were acceleration capacity, which the acronym AC, which reflects sympathetic system modulation, and then also deceleration capacity, DC, which reflects parasympathetic or valgal modulation, as well as time lag, which is a nonlinear heart rate variability metric indicating overall variability and signal complexity. So what they found was that individuals with high AC, low DC, or high time lag had significantly higher mortality risk even after controlling those traditional risk factors and also having medication for their treatment. So this study just helps us get a better understanding on heart rate variability because it shows that nonlinear heart rate variability metrics may be more informative in chronic disease contexts, especially in those heart failure patients. And the fact that heart rate variability can predict survival in heart failure patients can be suggestive that autonomic dysfunction contributes to disease progression and risk. So kind of going in theme with the more clinical route, I also chose the scenario for non-athletes. So heart rate variability is a useful metric outside of athletics. It is directly related to cardiovascular disease health indication, stress monitoring, and recovery or lifestyle feedback. So for patients with lower heart rate variability, it creates an association with hypertension, diabetes, chronic inflammation, increased cardiovascular disease risk, and higher mortality, especially in those cardiac populations. So getting a better understanding on that these patients, these chronic disease patients, especially those cardiac populations, can use exercise to improve heart rate variability, and using heart rate variability to track the progress of that will hopefully, if you see improvements in heart rate variability, you'll see improvements overall in all of these conditions in association. Since heart rate variability is improved with aerobic and resistance training, Good sleep, stress management, weight management, and lifestyle modification changes. These are all core components to cardiac rehab. And so I think that just further shows that, cardiac rehab does make an impact, and this is one of those measures that we can use to track its progress in improving cardiac related issues and cardiovascular fitness.